Thanks once again to the organisers for allowing me to speak here at this conference. One thing that gets me angry is seeing the misuse of science, and this is a good example of it. So I fished out this, to start with, I fished out an old PowerPoint from around the RPAD push-die era, and I thought, oh, this is going to be so out of date, I'll have to rewrite it completely. But it ain't. It's absolutely, you'll see things there and you'll think, oh my God, that's today, you know. It's right. Christine presented the precautionary principle. I'm sure everybody here knows it. Now, the main tool used to stop the implementation of the precautionary principle is risk assessment. Now, risk assessment is superficial. Well, no, it's actually a good idea. So think about what might go wrong before you do something and then design safety into it or don't do it. But the risk assessment can be turned to prove that something is safe when it patently isn't. So let's just think about this as a basis for the difference between pharmaceuticals and food. Now, to license a pharmaceutical costs probably rather more than that now, $500 million probably to get it to market. Food, well, food's been around for millions of years, but it's not the same sort of thing. Now, duration of exposure is usually for days or weeks for a pharmaceutical, under informed consent in milligrams or micrograms per day, whereas food exposure is lifelong, kilograms per day, tons in a lifetime. Which should we be more precautionary about? Well, the US has been doing an experiment for the last 10 years. There is no baseline data. There is no exposure data. They don't know who eats what. So it's an uncontrolled experiment. And if GM foods are causing any changes to common conditions, there's absolutely no way we would know. If you think about the conditions where the medical profession has said, hey, there's something going on here, thalidomide, okay, you wouldn't expect to see a case of phocomelia in a lifetime. And suddenly people were seeing 3 cases in their clinic. What's going on? And the exposure history was in the mother's case notes. The other was still Bistrol, which the first synthetic estrogen was introduced, and within a year or two it was being prescribed to women to stop them aborting. It's been shown to be, it does the opposite, in fact. But then 20 years later, young women were turning up in clinics with a very rare vaginal cancer. And people were saying, what is going on? And the exposure history was in the mother's case notes. That's it. So if it's a common condition, you're not going to detect it because doctors are seeing it all day, every day, unless you do massive epidemiology. Okay, so Soren Holm and John Harris, 2 bioethicists, published this paper in, I'll leave these slides, you can look at it, in Nature, saying you can't use the precautionary principle because it stops innovation. Peter Saunders, mathematician and husband of Mai Wan Ho, and I wrote to Nature with a riposte. And this is quite interesting because we brought up the Titanic. There may be very small probability a large ship traveling across the North Atlantic would hit an iceberg, but the captain should have thought more about it. And really, because it didn't really matter if the voyage lasted a few more hours. So you were saying about this, you have to do it quickly. No. Okay, so as I said, risk assessment, the main tool to stop the implementation of the precautionary principle and used as proof that things are safe. And largely, actually, in my experience, it's poorly understood by decision makers. My then 7-year-old son drew this cartoon for me. He's now an architect. Risk assessment was designed by engineers to assess the reliability of structures. And you have most of the information you need. Materials you've used, the geology, the metrology. And this leads to an over-design of structures. Of bridges are typically ×5 and aircraft are ×1.1. And the tighter the margin, the more research required. But it's not foolproof. This bridge wobbled, and they had to spend half the amount of money again to stabilize it. This plane disintegrated in midair. Those of you who know about these things, it's a comet, and it's got square windows. And when you put the temperature of the metal outside at -70, it becomes brittle, and it cracks at the corners. 3 of these aircraft fell. So although we have an awful lot of knowledge, even with these this is much less complicated than biology, make mistakes. So risk assessment goes through 4 phases. Regulatory risk assessment. Hazard identification. It requires you to think about what it is that might go wrong. So here we have this ignorance problem. People who introduced PCBs into the world, they knew that they were biopersistent because that was one of the attractions. They knew that they were lipophilic. They knew that they were semi-volatile. So they should have been able to predict that they would bioaccumulate, they would undergo long-range transport, all the things that we know about. Maybe they did think about them. We don't know. But once you've identified hazards, then you have to assess them. Now that's expensive, and that's what RPAD was engaged in, hazard assessment of these potatoes, through science, through experimentation. Once you've done that, then you have to do an exposure assessment, because if there's no exposure, it doesn't matter how hazardous it is, there's no risk. And these are often data models that are applied. And then when you have those 3 phases completed, you can attempt a risk assessment. But the risk assessment is only as good as the information in the first 3 steps. And risk assessment is now being applied to complex systems, such as ecosystems. And we don't have comprehensive data for those. And there are many nonlinear relationships with unpredictable singularities. I love this slide. This is a model of the known interactions in the Scotian food web. So up here you have the surface of the water. These are the air. These are the benthic organisms. Now, if someone tells you they can introduce, I don't know, a genetically modified salmon or some new, into a thing like that and say that they've done a risk assessment and they know what's going to happen. But they do. This is what's going on. I mean, this is just pie in the sky. So on the other side, we've got us who want to be objective and maybe skeptical about the science. And on the other side, you've got companies that are trying to sell products. So if a company came along and said, well, we don't actually understand the technology, the toxicology, or the ecological consequences of what we're doing. We don't understand it fully. It isn't 100% safe. That was Professor Vyvyan Moses, who was a spokesman for the GM. And many of the predicted hazards have already happened: gene stacking, horizontal gene flow, unpredicted toxicity, etc. You'd be unlikely to buy it. But that's the way, if they were being honest, that's what they should be saying, because that's... So formal risk assessment has been developed for regulatory purposes in reaction to disasters like PCBs. And the green revolution in agriculture is a case in point. And remember this phrase: it was introduced because we're all going to starve. Yeah, you have to do this because we're all going to starve. And we've had a loss of biodiversity and soil degradation and pollution of biota has been discussed already today. Sorry, I went back. This caught my, this was in a paper, I can't remember which paper it was. But where there's a red dot, there are over 150 species of bird breeding per 50 square kilometers. Now, this is nearly 20 years ago. And you notice that in Eastern Europe, there's high biodiversity, but in the West, Italy, Germany, UK, there's much lower biodiversity. Holland, high, because there's a lot of water there. And along the mountain tops, still higher biodiversity. But this is a direct effect of what we've been doing. So this needed a mode shift. Now, this is a lovely quote. There's a former director of the US EPA. If you, risk assessment can be likened to a captured spy. If you torture it long enough, it will tell you anything you want to know. So here's an example of this sort of fact-free model. So if you have an incinerator, it's emitting pollutants, and they are impacting on the local biota, which includes us. And so Jim Bridges, a professor of toxicology, this is what he would present. So they'd take a hypothetical person, and they'd stand them at a hypothetical maximum ground level concentration from this plume with pollutants that are modeled. And then they'd estimate how much extra this would put into that person. And they'd say, basically, well, this is just a smidgen and it's safe. But there is a very big unstated fact-free assumption. And that is that members of the population are not significantly exposed yet. So it's okay to put a bit in. It's only a bit. But if they looked at the data, every one of us is carrying around too much of the stuff already. The WHO have already published that. So this is rubbish. But that's what's presented at public inquiries. So this is a failure of hazard characterization. Not a single physical measurement of any kind is presented. So in these models, the assumptions you make can dictate the outcome, but they can be highly subjective, and indeed they are. Okay, so let's just go through a few slides before I finish on the area of GMOs, which I fished out 20 years ago, and I think you're going to find this quite interesting. So substantial equivalence is just a test of chemical composition. It's not predictive of biological effects. We need to know about biological effects, allergenicity, unpredicted toxicological effects. You won't get that from substantial equivalence, but that is the test that's being applied to say that it's safe. Now, these are extracts from actual risk assessments, and I don't laugh too loudly. I mean, so potential harm low, probability negligible, risk of damage effectively zero. Not an ounce of information given about how they've come to that conclusion. And here, this was Monsanto's risk assessment of GM sugar beet in Ireland, and it's the same tosh. Overall risk of damage is low to effectively zero. Completely unsupported statements. I got involved in the Chardon LL fodder maize. And it had this purified PAT protein put into it. So the risk assessment, it was the protein, the gene was taken from a different, it wasn't taken from maize, it was taken from canola. It was fed to a non-relevant species rat. They analyzed some anti-nutrients like phytate, again, not relevant. And substantial equivalence was actually ignored because there were changes in the fatty acid expression. and no whole food feeding trial in the target species of cattle. So this is the sort of thing that's going on all the time. They do lots of science. They produce massive reports. They are unreadable. They have more acronyms than spiders' knees, and for the average member of the population, are totally unreadable. And then they say it's safe. Well, hazard assessment was going on. We've been talking about this a lot and don't need to go over it again. Now, this was interesting. Dr. Horton, who published Arpad's paper, Richard Horton, in the Lancet, after extensive peer review, 6 or 7 reviewers, said that he was threatened by Peter Lachman, that he'd lose his job if he did this. But he went ahead and did it anyway. I think he's a great fellow, Richard Horton. He's a trooper. And, but these are the sorts of... Now, you have to say, why did Lachman do that? And does he have a contract? I mean, what's the story there? We never found out, but anyway. So all policymakers must be vigilant. This was published in the Lancet, to the possibility of research data being manipulated by corporate bodies and of scientific colleagues being seduced by the material charms of industry. Trust is no defense against an aggressively deceptive corporate sector. I think there should be a standard format for risk assessments, and they should state all hazards considered, those hazards considered but not assessed, those hazards not assessed but modelled, areas of uncertainty identified, and levels of confidence in the results. So these results are given as a binary, it's safe or not safe. But we all know that variability is very, very important. And then a time scale over which the risk assessment can be considered valid. So I think they should be made standard. Another thing which the society might like to consider, which is the definition of some technologies as pervasive. And should society consider whether certain activities should be reclassified for strict liability, for temporary licensing, as in the pharmaceutical industry, with pharmacovigilance. So when you're given a license to produce a pharmaceutical, you have to maintain pharmacovigilance, and the license can be taken away. That doesn't apply to most environmental chemicals. And as I've said, full transparency of hazard assessments, very important. The last slide, no risk is acceptable if it's avoidable. And a biotech spokesman has told us that nothing is 100% safe. And traditional foods have been tested for thousands of years, and GM foods at that time had been tested for 6 years. We're a bit further down the track now, but nothing much seems to have changed. And we're being asked to risk eating GM food for no immediate benefit to us, only to the manufacturers. And the rationale that's being presented for this is that we're all going to starve. And again, that's been discussed today. Tosh. Oh, there is another slide. So, precaution is the best option, or stopping doing it. Okay, that's it. Thank you very much.